Zach and I see a lot of people post-op and pre-op, and we like that because we think we can make a huge difference in your recovery and your likelihood of progressing to other bad things. So we have a whole protocol. So we're always happy to work with you guys. We're going to have surgery to work with you and get you going on a protocol because your outcome is definitely going to be better. And what do we do? Well, we usually start pentosan polysulfate shortly after the surgery. You don't want to be on it right before the surgery because it's a weak blunt thinner. But afterwards, a few days after you start it, reduces a lot of the overaggressive inflammation, reduces pain, helps to eliminate degenerative changes that might progress. Remember, if I replace even my right hip, well, that's not going to degenerate. But what might happen is, why does my left hip go to hell after that? It's because I've upregulated all of these systemic inflammatory cytokines. Now my left hip's gone, right? So we always recommend a course of pentosan, usually about 12 weeks after surgery. We usually start Nandrolone. So Nandrolone is an anabolic steroid, and it's kind of most famous in the bodybuilder world, but it is great for repair. And the studies on Nandrolone showing that people healed much faster after both shoulder surgery and joint replacement surgery using Nandrolone weekly for about 6 weeks post-op. It helps with pain, it helps reduce inflammation, and it helps rebuild tissue. It's anabolic, helps you regrow, and it helps you put back on your muscle. Because remember, you're going to lose muscle. You can't do much, right? So it helps put back on the muscle. And then you need your anti-inflammatory, musculoskeletal peptides, BPC, thymosin beta-4 for at least usually 6 weeks. For a couple of weeks, we do them every day, and then we go to 3 times a week. And then we always like people to consider things like a course of cerebral lysin IV if they have access to that. So going in post-surgery, there's some great data showing that when you have surgery, that anesthesia takes a pretty big toll on your brain. So number one, make sure you're really supporting detox pathways with high dose NAC after your surgery. So you're doing NAC like 1,800 milligrams a day after the surgery. But perfect world, if you could get cerebral lysin IV for a few days after the surgery, that's great. Helps with inflammation, helps with post-op recovery, helps with brain fog. And then we like GHK copper. GHK copper, remember, it's made by our body to help collagen production. So basically, GHK copper treated either topically over the wound, which is great because you can get a little bit of absorption at the wound site, or you can inject it systemically. And then we really like IV vitamin C. So you can get IV vitamin C, which is pretty easy to get for a lot of people now. IV vitamin C has been shown like at 10 grams for about 4 weeks, once weekly, really improves collagen synthesis. I mean, quite dramatically. So don't neglect things like IV vitamin C. If you can't have access to IV vitamin C, think about a liposomal vitamin C, a gram or two a day, because that really is important for collagen.